for the weekends and for the winters and for Christmas. Who knows?
Right. Now, we were mentioning about this as well. The UAE doctors have been warning of vision loss due to
Yeah.
delayed treatment for eye infections. A recent warning has been issued on the importance of prompt treatment for eye infections. And to tell us more about this, we've got Dr. Marta with us online. Dr. Marta, ophthalmologist, Barraquer Eye Hospital, Dubai. Dr. Marta, a special welcome to you. Good morning.
Good morning. How are you?
Excellent, Dr. Martha. We would love to know more about this issue of delayed treatment for eye infections and what are the complications and the problems that people can face.
Yes. Well, when there is an infection, there is an inflammatory process that leads to healing or not healing. Okay. So during this healing process, if we have an infection in our cornea, which is called keratitis, we can have a scar, which is one of the most common outcomes of not treated infections in your cornea. We can have a perforation, which means a hole in your cornea, and then we have to run and stitch it in the emergency room. We can have low vision. We can have an increased risk of complications, such as infection spreading to the other part of the eye, including the lens and the deeper structures. And we can have chronic eye problems like ongoing inflammation, long-term discomfort, and rarely we can have a risk of systemic infection. In rare cases, especially if the infection is caused by a fungus, we can have a spreading through the orbit and even to the brain.
So, Dr. Martha, why are regular eye checkups essential and how can they help in detecting both eye and underlying health conditions early in our lives?
Well, they are very important for maintaining both eye health. Our eyes can often show early signs of underlying health issues, sometimes before any symptoms are apparent. So with regularly visiting in an eye care professional, you can catch potential problems which can lead to more effective treatment and better outcomes. We can detect vision problems early because, children, when they have blurry vision, they don't complain because they think the rest of the people have the same blurry vision. So we can prevent a lazy eye in a child doing an ocular checkup. We can prevent and manage eye diseases called silent eye diseases like glaucoma, macular degeneration, and cataracts. And we can monitor signs of systemic health conditions like diabetes, hypertension, autoimmune disease, and even cancer. Okay, there are some types of cancer that produce problems in the eye. So we can also identify infections or injuries that otherwise would be silent, and we can identify changes related to aging, which are very important because usually, if you don't have blurry vision, you don't get your diagnosis of an eye disease because in the eyes you can have only pain or blurry vision. So if you don't have any of them, for example, in glaucoma, if your pressure is very high, you don't have pain and you don't have blurry vision, you can be diagnosed at the late stages.
That's very insightful, Dr. Martha. In terms of the common age-related eye problems, what are the common ones that you detect are among the age-related eye problems, and what role do they do in terms of early detection and treatment, and how can we well manage them and mitigate those eye issues?
Well, as we age, our bodies undergo several changes, and the eyes are not an exception. So the age-related problems are common in the eyes, but with early detection and appropriate treatment, they can impact the vision the less we can. So the first one, the most frequent we can see in the clinic is presbyopia, which is problems for reading. This happens after 40 years old because the lens of the eye becomes less flexible over time. So it's more difficult to focus on close-up tasks. The role of the focus on close-up tasks. The role of detection is essential for those who begin to notice difficulty reading small print or needing to hold books or phones farther away, which is something very frequent. Other thing related to age is cataract. Cataract is a clouding of the eye natural lens. It leads to blurry vision and typically develop over time and are more common cause of vision impairment in older patients. By the age of 80, more than half of the people will either have cataracts or will have had cataract surgery. So the role in detecting is only with regular eye exams because cataract progresses very slowly and it makes changes in your life, but patients get used to these changes. And the only treatment we have is surgery. We also have age-related macular degeneration, which is a progressive eye disease that affects the macula, the part of the retina responsible for sharp and central vision. Detection is very important because recently there have been developed several treatments with injections to treat one type of age-related macular degeneration called wet age-related macular degeneration. There is no cure, but with the treatment, we can reduce the impact in vision. And there is also a glaucoma related to age, which is high pressure that produces no symptoms but damages the optic nerve. Diabetic retinopathy in people with diabetes, and dry eye syndrome, which is more frequent from pandemics because we are using devices all the time, and this is drying our eyes a lot. We can see floaters and flashing lights in people with retina problems, especially in people with myopia. So it's a good idea to make a yearly follow-up and check the retina to avoid any retinal detachment. And with this, we can prevent vision loss, we can preserve quality of life, and we can manage symptoms effectively. And reduce healthcare costs, of course.
So, Dr. Marta, can you elaborate a little bit on the connection that you mentioned between the systematic health issues like diabetes and high blood pressure and their impact on our vision, especially the eye health?
Yes. There are two systemic health issues, mainly diabetes and high blood pressure. They can have a significant impact in our vision. Both conditions can lead to serious eye problems if not properly managed. Often affect the blood vessels in the eyes and cause damage to critical components such as the retina. So in diabetes, we have, as you know, two types of diabetes, type 1 and type 2. Both of them can produce what we call diabetic retinopathy, which is a problem in the retina, which is the most important part of the eye, related to the bad control of this diabetes. So what the main problem is that high blood sugar levels can damage the blood vessels, leading to leakage, swelling, or the formation of abnormal blood vessels that can bleed very easily.
So, Doctor, at what age do conditions such as cataract and other age-related macular degeneration that you're talking about typically develop? And what prevention and what preventive measures can you take in terms of actually avoiding a eye issue or a vision loss?
Well, cataract usually develop as a part of the natural aging process, usually starting around age 60 or older. Diabetic retinopathy is related to the time the patient has been diabetic and how is this diabetes being controlled. If the sugar control is bad, we can have complications after 1-2 years. If the sugar control is good, we can delay it to appear for 10-20 years or even avoid the problems. And regarding age-related macular degeneration, it's very important to do ocular checkup after 50 years old because it usually starts without symptoms, but we can see some signs in the retina if we evaluate the patient. So if the patient is in risk, we should reduce the time between follow-ups, and then we should give them some kind of measurements to monitor at home, and whether there's any change, they should come to visit us.
That was very informative, Dr. Marta, and thank you for all the insights and the advice that you've given with regards to the eye vision and improvement in terms of your, checkups with the doctors and the preventive measures. So thank you very much for being on the show with us.
Thank you. Have a good day.
You too, Doctor.
डॉक्टर मार्ता से बात हो रही थी ऑप्थेल्मोलॉजिस्ट बराकर आई